Welcome to Longevity Insights. Today, we're diving into a game-changing development in diabetes treatment, stem cell therapy, and China might be leading the way. Researchers there have done what many thought impossible, functionally curing type 1 diabetes in a patient. No insulin for over a year. And for type 2, patients are reversing diabetes and staying off medications for years. How is this happening? Massive government funding, cutting-edge science, and a fast-track approach to clinical trials. Like, subscribe, and hit the bell icon so you don't miss part 2, where we compare China's results to the US, Europe, and Japan. But first, let's go to Christian for the details.
Appreciate that, Adam. Let's dive in. 1. Breakthroughs in type 1 diabetes. For decades, treating type 1 diabetes has meant lifelong insulin therapy. But now, scientists at Peking University have taken a bold new approach, regenerating insulin-producing beta cells using stem cells. In a first-of-its-kind trial, doctors transplanted a patient's fat cells back into the body after reprogramming them into insulin-producing islet cells. Result? The patient stopped needing insulin within 75 days. 1 year later, still insulin-free with normal blood sugar levels. No immune suppression needed. Published in Cell, 2024, this is the first documented case of a patient functionally cured of type 1 diabetes using stem cells. Instead of relying on donor cells, which require immune suppression, this method rebuilds the patient's beta cells, avoiding rejection altogether. 2. Reversing type 2 diabetes with stem cells. Type 2 diabetes affects over 500 million people worldwide and is often thought to be irreversible. But China's latest research suggests that might not be true. At Shanghai's Changzheng hospital, doctors treated a 59-year-old patient with advanced type 2 diabetes using stem cell therapy to regrow pancreatic islet cells. Within 11 weeks, he was off insulin. 1 year later, no medications needed. Nearly 3 years later, blood sugar is still normal. Published in Cell Discovery, this study suggests that stem cells could restore beta cell function, not just manage symptoms. If more extensive trials confirm these findings, millions of type 2 diabetics could avoid a lifetime of medication. 3. Why China is leading the way. China's rapid progress in stem cell therapy comes down to 3 significant factors. A. Massive government funding. China has invested over $500 million into regenerative medicine, creating dozens of top-tier research centers. Unlike the US, where most research is privately funded, China's centralized funding structure accelerates trials and removes financial roadblocks. B. Flexible regulations. The US and Europe require long, multi-phase clinical trials, which can take a decade or more before treatments are available to the public. In contrast, China's hospital-based clinical trial system allows doctors to treat actual patients sooner while still gathering data. C. Personalized therapy with autologous stem cells. Most Western research focuses on donor-based stem cells, which require immune suppression. China is pioneering autologous, patient-specific stem cell therapy, where doctors reprogram a patient's cells into insulin-producing beta cells. This eliminates rejection risks and could make treatment more effective in the long term.
For decades, diabetes has been seen as a lifelong condition, but if these stem cell breakthroughs hold up, we may be on the verge of a true cure for both type 1 and type 2 diabetes. China's bold approach, significant funding, fast-tracked clinical trials, and patient-specific therapies is yielding results. But how does this compare to the rest of the world? In part 2, we'll look at the US, Europe, and Japan to see who's leading the race for a diabetes cure. Will strict FDA regulations slow down American progress? Can Europe's focus on safety deliver a long-term solution? Or will Japan's fast-tracked iPS cell technology win the race? Like, subscribe, and hit the bell icon so you don't miss part 2. And let me know in the comments, Do you think China's approach could be the future of diabetes treatment? The information provided in this video is a compilation of various sources and has been condensed for ease of understanding. This content is for informational purposes only and should not be considered medical advice. Always consult a healthcare professional before starting any new health regimen or treatment.